This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app. Today's podcast is on laser spine surgery. First of all, laser spine surgery is BS. It sounds good. It sounds like a miracle. I've got this bad problem, this burning nerve pain. It's going down my arm. It's going down my leg. It's killing me. I can barely see straight because this pain is so bad. And the laser can just go in there and zap my problem away without surgery, and I'll be cured forever. Well, it just doesn't work like that. First of all, the laser is going to burn tissue. That's what lasers do. So either the laser can do one of two things. Either the laser is going to burn the structure pushing on the nerve, or it's going to burn the disc to stiffen it up. And both of those things don't make any sense. So first of all, if you have something pushing on the nerve, like a herniated disc or spinal stenosis or spondylolisthesis or scoliosis, these things push on the nerve. They cause nerve pain. They can also cause numbness and weakness. So you've got this mass pushing on the nerve. You can't burn the structure pushing on the nerve without risking burning the nerve. It doesn't work. It's too risky. You know, the laser has been around for 20 years. If it worked, we'd all use it. I don't know a single surgeon that I really trust who works at any major university or takes care of professional athletes anywhere in the country that uses the laser. If it worked, we'd all use it. I would love to use the laser. I wish it worked. If I could zap in there and cure somebody's problem and get them back on the field and get them back playing their sport or get them back to their life without even having to do surgery, just using this little laser to zap things, it'd be a miracle. So if something's pushing on the nerve, you can't burn the structure without risking burning the nerve. And that's why no one uses the laser. It sounds great, but it doesn't work. The second component is a lot of these places, I think what they do who claim to use a laser, what they actually do is the same basic surgery as everybody else, which is either a microscopic or endoscopic or some type of decompressive surgery, a laminotomy where you can make a hole in the lamina, you make more room for the nerves. If there's a disc herniation, you take the piece of disc out, it's a discectomy. Whatever it is, if there's some pressure on the nerve, we basically go in, remove the pressure off the nerve. We use a drill to thin down the bone. We have little biters and curettes, sharp instruments to take the pressure off the nerve safely. Very common routine surgery. That's the basic surgery we do all day long. We'll do 4 to 6 in one day. That's what people do all over the world. So I think what these places do is they do the same basic surgery as everybody else. They go in, they take the pressure off the nerve. They just say they use a laser for some point of the surgery that is not really relevant. Maybe they burn the fat on their way in or out so they can say they used a laser. But I don't think anybody is actually burning the herniated disc or the ligament or the bone spurs that are putting pressure on the nerve, because it doesn't make any sense. You wouldn't risk burning the nerve. These nerves are sensitive. You put a hot laser in there and start burning things around, you'll be like Luke Skywalker burning everything up. It's not going to work. It can be highly detrimental. You can cause a neurologic loss, a foot drop, weakness, paralysis, all sorts of bad things. So I don't think anybody's actually burning the structure, putting pressure on the nerve, because that's just too risky. And the high temperature we know will adversely affect the nerve. So what was the other thing they may be doing is, what they may do is after a discectomy so a piece of disc has herniated, a piece of disc is torn, it's putting pressure on the nerve. And so what we all typically do is go in and take the pressure off the nerve, take the small herniation out. Well, that leaves a hole in the back of the disc, which usually takes 4 to 8 weeks to scar in and heal. So what some people may use a laser for is to put the electric probe into the disc space, turn it on, and basically burn the disc tissues in hopes that will stiffen it up and seal basically the hole where the disc herniation came out of, in hopes of making the disc stronger and sealing that hole to prevent a recurrent herniation or another piece coming out of the hole. And that kind of makes sense. And, you know, we did that 15, 20 years ago. There was a procedure called an IDET, which took an electric probe, stuck it in the disc and burned the disc in hopes of stiffening the disc up and getting rid of some of the pain generators. Well, that was shown to not work. I don't know anybody who uses that procedure anymore, because what we found is that, one, it just doesn't make a difference at best, but at worst, if you're burning the human tissue, it makes it weaker. It doesn't make it stronger. I don't know anybody who uses that procedure anymore because what we found is that, one, it just doesn't make a difference at best, but at worst, if you're burning the human tissue, it makes it weaker. It doesn't make it stronger.